Has your GP practice said that you're using too many of your blue salbutamol reliever inhalers? Are they insisting that you get a review before you order any more? This is not about restricting prescriptions or anything to do with cost. This is because your GPs and nurses want your asthma to be better controlled and are following the recommendations that came out of the National Why Asthma Still Kills report. This report found the disturbing reasons why there are still too many people dying from asthma attacks and how they could have been easily prevented with better inhaler prescribing. And I want to spread awareness of the simple steps that everyone can take to help prevent asthma deaths. There will be timestamps in the description box below, as well as the references. But I encourage everyone, whether you have asthma, have a loved one with asthma, or are in healthcare, to know about the key findings. But before I start on the content, here are my disclaimers. I'm Eloise, I'm a UK pharmacist of 20 plus years, and I'm enthusiastic about clear, accurate information on medicines and supplements that everyone can understand. The information I provide is for educational information only and is my own opinion. However, I do my best to base it on the most up-to-date evidence, but always contact your own healthcare professional for individual advice on your personal situation. First, I'm going to jump straight in with the things I wish all asthmatics and their carers knew before going into details about the report and the recommendations for your asthma reviews and the better inhalers to use. The reliever inhaler, which is usually blue in the UK and known as either salbutamol, Ventolin or terbutaline, although life-saving, doesn't actually prevent the underlying cause of an asthma attack, and relying on it all the time can cause the reason for the asthma to worsen. And this was confirmed in the Asthma Still Kills report. Think of your lungs as having a badly designed roof of your house, and every time it rains, you prevent the house from flooding by using buckets and towels. You're only solving the water coming in and not the reason why it's coming in. And until you mend the roof, you're going to end up with more and more damage each time until one time where everything gives way, the whole ceiling collapses, and having buckets and towels is pointless. The same with your lungs. During an asthma attack, your lungs have been irritated and inflamed and are closing up, and the reliever inhaler helps open them up in an emergency to allow you to breathe. However, unless you understand what's causing the irritation and the inflammation and reduce the triggers and treat that inflammation, the lungs will continually worsen, and potentially at one point, your emergency inhaler will not be sufficient. Therefore, having a personal asthma action plan where you know what your triggers are, how to avoid them, and being on the correct treatment of inhalers to reduce the effects and the damage caused is like mending the roof so that when the rain comes in, not as much gets through. One of the main ways. The Why Asthma Still Kills report in 2015 was a national review of asthma deaths in the UK and is the largest study worldwide to date. The primary aim was to understand the circumstances surrounding asthma deaths, to identify avoidable factors and make recommendations to improve care and reduce the number of deaths. The report came with key recommendations for NHS organisations, medical professionals, as well as prescribing and medication reviews. And I will mainly focus on the recommendations about inhalers, but I recommend that anyone can read the recommendations online and the executive summary that is specifically written for people with asthma and their carers to read and to understand so that you can hold your healthcare professionals and organisations accountable. The study identified deaths in 195 people between February 2012 and January 2013. And they gained extensive information about each death from multiple sources, including primary and secondary and tertiary care, as well as ambulance, paramedics, out-of-hours care providers, coroners, post-mortems, and it was reviewed by an expert panel. The report looks into many different factors about these patients in the lead up to their final asthma attack that caused their death. And they looked at how many times they'd been in contact with their GP surgeries, with specialists, having asthma reviews, whether they'd been trained on their inhalers, whether they knew what their triggers were, whether any preventative treatment was given. And I'm not going to go into the background of the information for all of that, because that is very intensive, even looking at sort of the areas where they lived and the levels of pollution and such like. It's very interesting, a very good read, but I'm going to jump straight in to the findings that they found about prescribing and medicines use. And one of the main things that they found was the majority of people that ended up dying from an asthma attack were over relying on their short acting relievers, their salbutamol inhalers. The majority of them were collecting over 12 a year, and some were even collecting over 50 a year, and they were continually using their blue reliever inhalers but not actually getting any benefit. That asthma was just continuing to worsen. So they looked at them and they assumed, with the amount of reliever inhalers that they were taking, that they should be on preventative treatment, they should be under secondary care, and that wasn't the case. The majority of people, they should have been having at least 12 preventer inhalers a year if they were taking it twice a day, as they should be doing. And many of them were not prescribed a preventer inhaler, and even if they were, they weren't collecting it and using it and being getting the benefit from these preventer inhalers. Also, they found that there was another subgroup of people where they'd not been given the corticosteroid preventer inhalers. They'd just been given a long-acting beta agonist, so a long-acting version of the salbutamol. As I said, that the salmeterol or formoterol. And because this was giving them a false sense of opening up the airways, they were using that, and it wasn't actually providing any benefit in preventing, and unfortunately some of them also died. So these were some really big indications showing that these patients had been collecting their reliever medication but not being intervened and being given the correct information about using their preventer medication on a regular basis. So I'm going to move on to the key recommendations about the inhalers. Following on from those statistics and the realisation that the majority of people leading up to the asthma deaths were over reliant on their reliever inhalers, and that was a warning sign that there wasn't enough being done to help get their asthma under control, and that they needed more input from healthcare professionals in finding out what the triggers were and actually helping prevent future problems, and making sure that their medicines and their inhalers were optimized to prevent issues. So from this, the recommendations were to make sure that anybody who has asthma and is needing to use their reliever inhaler on a regular basis and ordering it every month, they should be invited for an urgent review of their asthma control, and making sure that they were using their devices correctly, that they're not overusing it and not getting the benefit, that they're actually getting the benefit from their inhalers. And also to highlight any people who may have been given a preventative inhaled corticosteroid but was not actually collecting it, to highlight those and ensure that they are compliant and able to use their inhaled corticosteroids, and talk through any of the issues with why they might not be using it and any fears that they have, and helping get that under control. And again, with the findings of the LABA inhalers being overused without the inhaled corticosteroid partnered with it, to highlight those patients for review. And this is one of the jobs that myself and my colleagues across the country do on a daily basis, is help our GP practices highlight and find these patients that we need reviewing, help train the admin staff and reception staff to spot people that may need to get called in to see the GP or the nurse for a review earlier. So please be nice when the reception staff are asking you about how much you're needing and why you are needing it. It's so that they can see whether they need to flag it up to the nurse to get you an urgent review. And then I do the training with the nurses and with the GPs on how to actually look at the computer system, see how many inhalers somebody's had, and help determine whether they need their management changing. In this section, I'm going to show you how GP practices and their area medicines optimization teams look at the prescribing data of inhalers and see how they compare on the different indicators and recommendations set out by the Why Asthma Still Kills report. So this website that I'm on, openprescribing.net, is publicly available, and it has the anonymised data of all the prescriptions that were done by GP practices and dispensed by community pharmacies in England. So there's plenty of different ways that you can do the analysis down to your practice level, looking at specific drugs, but we're going to have a look at the all of England and have a look at some of the different prescribing measures. So if we go straight on to view prescribing measures, and then if we scroll down, there is a whole long list of graphs of all different indicators, but we will just start with at all the respiratory indicators. So the top of the list, the top one that comes is about making sure that the salbutamol inhaler that is being prescribed is the one that has the best or the lowest carbon footprint, because we're trying to make sure that the NHS is as carbon neutral as possible, and the manufacturers are helping us with that, making sure that when they process the inhalers there is low in carbon footprint as possible. Again, this next one is about it's half to do with the lowering carbon footprint, because the dry powder inhalers don't have the aerosols in them and have a low carbon footprint, but also because the dry powder inhalers are actually better for people to use, because there is actually more evidence of more of the drug actually getting into the lungs, because people can coordinate the suck and getting the drug into the lungs, rather than with the MDIs aerosols, where quite often if it's not coordinated correctly you can be blowing out as the aerosols trying to pump it in. But that is something that you would need to discuss with your inhaler technique with your nurse to find out what is best for you. The next indicator is about the amount of high dosed inhaled corticosteroid inhalers to the lower dosed inhaled corticosteroids, because one thing that you should always be having is a review and checking that you are on the lowest dose that is keeping your asthma under control. As you can see, there's a general trend to lower this. This blip at the start of COVID, I will explain on the next graph. So the next graph is the main one where we will be going through. So this is the short-acting beta agonist inhalers, so the salbutamol inhalers that you use as your emergency inhaler, and the percentage of that compared to the prescribing of the inhaled corticosteroid inhalers. And interestingly, in the February, March, as we went into lockdown, there was a big increase in the amount of prescriptions for salbutamol inhalers, with everybody making sure that they had their supply of salbutamol inhalers in lockdown in case they required it with getting an infection of COVID. But as you probably can see, the actual amount of inhaler use of the salbutamol inhalers during lockdown has actually reduced, as people weren't actually being exposed during COVID in the general population. And also because of the effect of this Why Asthma Kills report and the reviews that nurses and pharmacists that have been doing over this time, the general trend is the amount of SABA inhalers, so the salbutamol inhalers, has been reducing, and this is especially reduced in the last year, when this indicator has really been given to GP practices and their prescribing teams to really focus on getting these asthma reviews done. So you can actually do a breakdown and compare all the sub locations in England on this measure. So this is the same measure, but we're now going to have the graphs broken down for all of the different local areas in the country. And it always starts off on this website with them prioritising the one that is highest first. So as you can see here, the 3 top areas in the country for doing mainly salbutamol prescriptions is South Tyneside, Knowsley and South Sefton. And you can see that they are quite above the national average, and so hopefully they will be flagging up and putting together a process to try and review all their patients that are taking salbutamol inhalers and making sure that they've got the preventative treatment that's needed. And if you go down and see a few more, so we've now got Liverpool, Hull and Sunderland. And if you have a look at Sunderland, you can see that they've obviously been doing some work during 2022. So from December 22 all the way through to sort of the spring here in 23. And there's also some other areas like Bolton. There's been a massive change. The Wirral, Bassetlaw, Durham is also making a big change there. So have a look and see if I hope you found the information in this video useful and interesting. It is scary that there is still people dying from asthma attacks when we know that there is preventative treatments out there. So I would encourage you, if you've got asthma or any of your loved ones with asthma, if you're finding that you're needing to use a blue inhaler more and you're getting through a full blue inhaler every month, that you book an appointment to discuss that with your asthma nurse. And if you haven't got a preventer inhaler, to start using one and making sure that you use it regularly to prevent problems. And if you are on one, that you get it reviewed and whether that you need a different type so that you can use it easier or that for a higher strength. And if it's still not controlling, make sure that you insist on getting a referral to see if there's any more that can be done. We need to make sure that we don't have as many asthma deaths when we could be preventing them. So thank you so much for getting to the end of the video. If you liked this video, please like and subscribe if you want to see future videos of information that I produce. I will be linking to my previous videos so that you can go back and look at any that you've missed. And please comment below with any questions that you have and any ideas that you would like me to produce for future.